Isn't it amazing? You know, that little sound, maybe just a slight whoosh your vet picks up in your dog or cat's chest. It can actually tell us so much about what's happening inside their heart. We're going deep on heart murmurs today.
Exactly. We're really unpacking what these sounds mean. We've looked at sources covering, well, everything from the basic definition, how they're made, to how vets classify them by timing, loudness, even their shape and location. It's quite detailed.
Okay, so let's start at the beginning. A heart murmur. It's basically a vibration, right? It's different from that normal lub-dub.
That's the core idea. The key phrase is disturbed blood flow.
Right.
When blood flow isn't smooth through the heart, maybe hitting an obstacle or leaking backward, it gets turbulent.
Like water hitting rocks in a stream.
Precisely. That turbulence creates vibrations, and those vibrations are what the vet hears as a murmur with a stethoscope.
Got it. Now, the timing seems critical. I saw stuff about S1 to S2, S2 to S1. Can you break that down, make it a bit more intuitive?
Sure. Think of the heartbeat. Lub-dub. S1 is the lub. That's when the heart cracks, pushes blood out. That whole phase is called systole. S2 is the dub, when the heart relaxes and fills back up. That's diastole. So a systolic murmur happens during systole, between the lub and the dub, during that squeeze.
And what kind of problems cause a murmur then during the squeeze?
Oh, quite a few things, actually. In dogs and cats, very common causes are problems with the main valves, the mitral and tricuspid valves. Maybe they get thick with age, that's endocardiosis, or they don't close right.
Leaky valves.
Leaky valves, exactly. Also, diseases of the heart muscle itself, cardiomyopathy, can make the valves leaky. Interestingly, young animals, puppies and kittens, sometimes just have flow murmurs because their blood's moving so fast while they grow.
Huh. So not always a disease.
Not always. Anemia can do it too. Or congenital issues like valve malformations, holes between chambers atrial or ventricular septal defects, or narrowed valves like pulmonic or aortic stenosis, even complex things like tetralogy of Fallot, and less often, infections like endocarditis or hyperthyroidism, even heartworm.
Wow. Okay. That's quite a list for systolic murmurs.
It is, which is why just hearing a murmur isn't the full diagnosis. The timing, the sound quality, it all helps narrow it down.
Right. So what about diastolic murmurs, the ones happening between the dub and the next lub when the heart's filling?
Yeah, diastolic murmurs are generally less common. They often point towards a narrowing or stenosis of those mitral or tricuspid valves, makes it harder for blood to get in, or they can be caused by leaky aortic or pulmonic valves, the ones controlling outflow. Blood flows backward when it shouldn't. That's often linked to endocarditis on those valves.
Okay. And then there are the ones that don't quite fit, continuous and to and fro.
Right. These happen throughout most or all of the cycle. The classic continuous one is patent ductus arteriosus, or PDA. That's a blood vessel that's supposed to close after birth but stays open. Creates constant turbulent flow.
Like a leaky pipe that never stops.
Kind of, yeah. And to and fro murmurs. They have this interesting shift in sound around the S2, the dub. You might hear that with, say, a hole between the ventricles, combined with a leaky aortic valve, or a narrowed aortic valve that also leaks. It's fascinating how the specific sound pattern can be like a signature for the problem.
It really is like decoding sounds. Okay, so we've got timing. What about loudness? This grading scale, I to sec, how useful is that?
It's a standard way to describe intensity, though it's a bit subjective. Grade 1 is super faint. You really have to listen hard in a quiet room. Grade 6 is, well, booming. You can often feel the vibration, that's the palpable thrill, and might even hear it slightly off the chest.
Wow.
Now, generally, louder murmurs, maybe grade 3 or higher, often mean a more significant issue, something really affecting blood flow, what we call hemodynamically significant.
Often, but not always.
Exactly. You can't rely just on loudness. A quiet murmur could still be serious, and sometimes louder ones are less critical than you'd think. It's a piece of the puzzle.
Okay. And you mentioned radiation, too.
Right. That's about how far the sound spreads from its loudest point. A murmur that radiates widely might suggest a bigger disturbance.
Got it. Let's move on to the shape of the sound. You compared it to instruments.
Yeah, it's a good analogy. The shape or configuration over time tells us about the flow dynamics. Some are plateau murmurs, pretty consistent loudness. That often means steady regurgitant flow, like leaky mitral or tricuspid valves, or a ventricular septal defect.
Okay, steady sound, steady leak.
Then you have crescendo decrescendo murmurs. They get louder, peak, then fade. Think diamond-shaped. That's typical for ejection murmurs, blood being forced through a narrow opening, like aortic or pulmonic stenosis. The sound builds as the pressure difference peaks.
I can almost picture that, like squeezing something through a tight spot.
Exactly. And finally, the crescendo murmurs. They start loud and get softer. Often heard with diastolic issues like leaky aortic or pulmonic valves or narrowed mitral tricuspid valves.
So the shape really reflects the physics of the flow.
It does. It's pretty amazing what you can deduce just by listening carefully.
Which brings us to location. Where the vet puts the stethoscope must be super important for figuring out which valve or structure is involved.
Absolutely critical. Each valve area has a point on the chest where its sounds are typically loudest. We call these points of maximal intensity, or PMIs. In dogs, for example, the mitral valve is best heard on the left side, low down around the fifth rib, near the elbow.
Okay.
The aortic valve is a bit higher and more forward on the left, maybe fourth rib space. Pulmonic is usually left side too, but lower and more towards the front, second to fourth rib space. Tricuspid is generally on the right side, third to fifth rib space.
And is it different for cats? I know they're smaller, maybe things are shifted.
Slightly different, yes. Cats' hearts sit a bit differently. The mitral area might be a bit further back, fifth or sixth rib space on the left. Aortic and pulmonic areas are often close together on the left. Second or third rib space may be slightly different heights relative to the sternum. Tricuspid is still generally on the right, maybe fourth or fifth rib space.
So knowing those spots and seeing where the sound radiates.
Helps pinpoint the source. You combine the timing, the loudness, the shape, and the location. It builds a picture.
Right. So we know the what, the when, the where. Let's talk why. What are the basic underlying reasons blood flow gets disturbed?
Fundamentally, there are about three main ways. One, you can have blood flowing really fast, maybe too fast, through a normal structure or through an abnormal opening, or sometimes things in the heart vibrate.
Okay. High flow or vibration?
Two, there's an obstruction. A narrowed valve, or stenosis, forces blood to squeeze through, creating turbulence, like putting your thumb over a hose pipe.
Creates that Jen effect.
Exactly. And three, backward flow or regurgitation. A valve doesn't seal properly, so blood leaks back the wrong way. Or blood flows through a hole it shouldn't, like a septal defect or that PDA we mentioned.
Be a faulty one-way door.
That's a great way to think about it. So high flow, obstruction, or backward leak, those are the main culprits.
Okay, so the vet hears a murmur. They've assessed its characteristics. What comes next?
They can't just rely on the sound alone, surely.
Oh, absolutely not. The murmur is a huge clue, but it's just the start. First, you have to be sure it is a murmur. Differentiating it from other heart sounds like split sounds, clicks, gallops, or even from respiratory sounds like crackles in the lungs or rubs is step one. Timing with the heartbeat and breathing is key there.
And checking other things, like you mentioned anemia.
Right. Looking at the pet's gum, called kale gums, might suggest anemia, which can cause a murmur. So the physical exam is broader than just listening.
Then you bring in the technology. Definitely. Chest x-rays or radiographs give a good overview of heart size and shape and check the lungs and blood vessels. But the real star is usually echocardiography, ultrasound of the heart. That lets us see the heart muscle, the valves, the chambers, watch them working in real time.
That sounds incredibly detailed.
It is. And Doppler echo adds another layer. It uses sound waves to map blood flow, showing its speed and direction. It can visually confirm leaks or obstruction.
So that confirms the cause of the murmur.
Very often, yes. We might also use an ECG, electrocardiogram, to check the heart's electrical activity for rhythm problems or signs of chamber enlargement. And blood tests are important too. A CBC checks for anemia or infection. Biochemistry looks at organ function. Your analysis gives clues. If we suspect endocarditis, that heart valve infection, then blood cultures or specific tests for bacteria like Bartonella might be needed. It's a whole diagnostic process.
It really is detective work. So when a vet finds a murmur, it's not always bad news, right? You mentioned those innocent murmurs earlier.
Correct. That's crucial, especially in young animals, puppies and kittens under 6 months or so. It's pretty common to hear soft systolic murmurs. Often these are just physiologic, related to rapid growth and high blood flow, and they disappear on their own as the animal matures. No actual heart defect.
That must be a relief for pet owners.
It can be, but the recommendation now is usually that if a murmur is still there after 6 months, it's worth investigating further, typically with an echo, just to be sure. And remember, things like anemia, fever, even just being really stressed or excited at the vet's office can sometimes cause temporary benign murmurs too.
But if it is caused by a real structural problem, what are the potential long-term concerns?
Well, if the murmur signals significant underlying heart disease, maybe severe valve leakage or a major structural defect, the heart has to work harder. Over time, this can lead to changes in the heart muscle and eventually congestive heart failure.
And that's when you see symptoms.
Yes, that's when you might start seeing signs like coughing, especially at night or after exertion, difficulty breathing, maybe a swollen belly from fluid buildup, or just getting tired easily. That's why early detection and monitoring of significant murmurs are so important.
Okay, this has been incredibly insightful. Let's try to wrap up the main takeaways from this deep dive.
Sure. So, fundamentally, a heart murmur is a sound, a vibration, caused by turbulent blood flow inside the heart, not the normal lub-dub. We classify them by when they happen systole, diastole, or continuously, by their loudness on that 1 to 6 scale, by their sound-shaped plateau, crescendo, decrescendo, or decrescendo, and crucially, by where they're loudest on the chest.
And each of those details gives clues about the underlying problem, whether it's high flow, an obstruction, or a leak.
Exactly. And while some murmurs, particularly in young pets, are innocent and resolve, others point to potentially serious heart disease. Diagnosis involves not just listening, but often imaging like X-rays, and especially echocardiography with Doppler, plus other tests if needed.
It really highlights the skill involved in veterinary cardiology. You're piecing together this acoustic puzzle.
It is. Listening is just the first step, but it's a critical one.
It really makes you appreciate the information packed into just listening. Which leads to a final thought. Considering how much we can learn just from listening carefully to the heart, what other subtle sounds or signals, maybe in nature or even our own bodies, might hold equally deep insights if only we knew how to properly tune in and interpret them.